Hello everyone, I'm Daniel Steele, your instructor for SPPH 538, and I'm coming to you from the traditional, ancestral, and unceded territory of the Musqueam people. In this lecture, I'm going to talk to you about utilitarianism and public health. And this lecture will cover the first reading by Savulescu and colleagues from week 2. So utilitarianism, what the heck is that? Well, you might have heard of utilitarianism before. The main idea of utilitarianism is that ethics, morality is about doing what will result in the best consequences overall. More specifically, utilitarianism has 3 key features, and these all came up in the readings in various points, but I'll highlight them here. So the first is utility, and this is the idea that the only thing that matters for morality is utility, where utility is basically like well-being or happiness. And if you think of that, the important thing to keep in mind is all the things that don't matter according to utilitarianism. So for example, that means if you're deciding what's right and wrong, your intentions don't really matter. What matters is the outcome, how much happiness or well-being is produced by the action. The second key feature of utilitarianism is what's known as impartiality. Each person's utility counts the same. Nobody's happiness counts for more than anyone else's. Now, in its time, so utilitarianism was invented by a man named Jeremy Bentham, who's pictured up here in the sort of 18th and 19th centuries. And this is an idea that was very radical at that time. The idea that the utility of the King of England counted the same as the utility of a commoner. This is would have been a very radical idea. And finally, the principle of utility, and this is the idea that the morally right action is the one that results in the greatest sum of utility. So in other words, if you're looking at, say, 2 different possible actions you could choose, you sort of add up all the effects, all the pros and cons, and the one that results in the greatest total amount of happiness or well-being, that's the one you should choose according to utilitarianism. And it's important to remember that according to utilitarianism, that's the morally right action to choose. It's the right thing to do. Now, I want to begin by clarifying one common misunderstanding about utilitarianism. And this misunderstanding, I think, stems from a famous statement that Bentham made, or a famous sort of one-line sort of description of utilitarianism, where Jeremy Bentham said that utilitarianism is basically the greatest good for the greatest number. And generations of students ever since have interpreted this claim to mean that utilitarianism just means do what benefits the most people. And that is a misinterpretation. What utilitarianism says is you should do what produces the most benefit overall, the most well-being overall. Other things being equal, benefiting more people is a plus according to utilitarianism. But that doesn't mean that utilitarianism just says always, do what benefits the most people, majority rules, whatever helps the majority is the best thing. That's not what utilitarianism says, because sometimes a large benefit for a smaller number of people might add up to more than a small benefit for a larger number of people. We'll have an example about that in class to bring this idea out. But for now, what I want to draw your attention to and want to emphasize is that if you want a short, pithy utilitarian slogan, a better slogan would be get the most utility from your resources. Get more bang for your buck. Or if you wanted to put it in public health terms, get the most population health from your budget. So the idea is you've got a budget and you want to do as much sort of benefit, as much sort of well-being, happiness, health as you can get from that budget as you can. In one word, that would be efficiency. Get as much good as you can from the budget that you have. Okay, so with that in mind, here are some sort of rough and ready rules that you might apply in sort of real life health settings that might sort of follow from utilitarianism. And these rules are all kind of approximations. So none of them are exactly what utilitarianism says, but they sort of approximate it. And as we go down, we'll get more and more closer to sort of exactly what utilitarianism says. So the first is that the more lives you save, the better, the number of lives. So if you were deciding which policy to pursue in public health, say during a pandemic, the first step might be to see which policy saves the most lives. Okay. But notice that's not going to be an exact fit with utilitarianism, because from a utilitarian perspective, it's not just the number of lives, but you have to think about how many years each of those people have left in their lives, because of course no one lives forever. And when you save someone's life, really all you're doing is you're sort of postponing their eventual and unavoidable demise. And so it's really going to matter how long that's being postponed for. And of course, that depends on the health and the age of the person. And so years of life is something that's a bit more fine-grained. So it's not just the lives saved that matters, but the years of lives. So the more years of life you save, the better. But again, remember that this is also going to be an approximation for utilitarianism, because it's not just the years of life that matter, but also how happy, how much well-being are present in each of those years of life. So you need to think also about the quality of life. So this is why if you studied healthcare economics, you probably encountered ideas like quality adjusted life years. Quality adjusted life years are essentially a way of trying to approximate try to measure the quality of a year of life. So where 0 means that you're dead, and 1 is a year of full health, and then you can have numbers that are between for a year where you're alive, but you're not fully healthy. And so here you might say utilitarianism is basically saying in public health, the more quality adjusted life years saved, the better. Maximize quality adjusted life years. And that would be pretty close to what utilitarianism means. But even there's a fine distinction. You can imagine two people who are sort of equally healthy, the same age, and so the number of quality adjusted life years remaining for these two people are identical. But if one of these people, let's say, is an ER doctor who does all kinds of great work, and maybe he takes a couple months out of the year to go to Honduras, and he has a health clinic that he helps run there, and it helps people out, and he does all these good things. He does all these wonderful things outside of just being a happy person himself. Imagine that person versus someone who's just sort of greedy and mean and violent, but who's also healthy and has many years of life. Those broader social effects would also matter for utilitarianism. Obviously, those kinds of effects are very difficult to measure, and certainly very difficult to measure in any kind of unbiased way. So in public health, typically we just leave it at quality adjusted life years. But it's important to remember that theoretically, from the point of view of utilitarianism, these social effects would matter. Now, utilitarianism has some pretty distinctive features in comparison to other ethical theories, and these were brought out in the readings. And so I'll just note 3 of these here. So one is that when medical resources are scarce, utilitarianism will tend to prioritize those who are younger and don't have comorbidities. So this is illustrated in this example from box 1 from the Savulescu reading. And that's an example about you have, say, 2 patients and you only have 1 ventilator, and it's sort of like this COVID-19 scenario. And the idea is that if both of these patients need the ventilator, it would make more sense to give it to the younger patient who has less sort of comorbidities than a patient who's older and has more comorbidities, because you'd expect to save more quality adjusted life years if you give it to the younger patient. So that's one feature that can be very controversial, and was in fact controversial back during the COVID-19 pandemic. Another distinctive feature of utilitarianism is that the difference between acts and omissions don't matter for utilitarianism. It only matters what the consequences are. If someone dies as a result of you directly killing them, like you push them in front of a bus, that's no different from the point of view of utilitarianism than if the person was walking in front of the bus and you could have just reached out and grabbed them and stopped them, but you didn't do it. In either case, the result is the same. There's no difference in what's right or wrong in this case, according to utilitarianism. Finally, and importantly for public health, utilitarianism says there's no moral difference between statistical and identified lives. And what this means is that sometimes you'll have a policy, an intervention, say like vaccination, and this will prevent deaths, but you don't know which deaths it prevented. In other words, if you say vaccinate 1,000 children for the measles, well, if you hadn't vaccinated those children, some of them would have died from the measles, but you don't know which ones they would be. But the idea of utilitarianism is that statistical death is just as important as a death of a person you can identify, like a sick child who's in the hospital. And again, this is something that will strike many people as unintuitive, and that's something we can talk about in class. Now, one of the most common objections to utilitarianism is that utilitarianism sort of overrides and doesn't give adequate weight to individual rights. It just sort of focuses on this sort of collective population benefit without considering, the individuality of each person and the rights that each person has in virtue of being a separate individual. And here's an example that sort of illustrates this idea, and illustrates the idea that utilitarianism can justify sacrificing the rights of a few for the good of the many. So here's Joe over here on the left, and Joe suffers a serious but not life-threatening head injury while robbing a liquor store. So Joe is a person who does lots of bad things, and he robs a store and he gets injured. And when Joe is brought to the hospital, the surgeons realize that although Joe is not a morally good person, he has really great organs, and if they secretly euthanize him, they can harvest his organs to save the lives of 5 other people. So that's what they do. They secretly euthanize Joe. They falsify the documents to say that Joe just died from his injuries, and then they transplant these organs into these other people who go on to live happy, productive lives. And so the idea of this example is that according to utilitarianism, although it seems monstrous to murder Joe and take his organs in this way, it in fact generates more utility, more well-being overall than just treating Joe and letting him go back to his life of crime. Now, that seems like a sort of silly made-up example. A more realistic example where you've got this rights of the individual versus the collective good might be one in which you have an outbreak of a highly contagious and deadly disease for which there's no vaccine and no effective treatment. And if there's only a few cases of this disease, the government might want to really make sure it doesn't spread, so that if anyone tests positive for the disease, they'll be forcibly held in quarantine. Now, in this case, you're restricting the rights of an individual very significantly for a broader benefit. Now, this is a more realistic example. It's also one that seems less obviously wrong than the example of Joe and his organs. And you can pause the video and think about why that might be. All right, moving on to act and rule utilitarianism. So these kinds of examples about Joe and sacrificing the rights of the few for the good of the many is something that many utilitarians over the century or two that utilitarianism has been around have sort of worried about. And one way they've tried to address this is by distinguishing between different types of utilitarianism. And these were discussed in the Savulescu reading. And so the idea is that act utilitarianism basically says choose the action that results in the greatest sum of utility compared to other actions. So where you consider each action individually, where rule utilitarianism says follow the rules that would result in a greater sum of utility compared to other rules that you could have followed. So in other words, rather than asking, in this particular case, which is the action that will produce the best consequences, you would ask, okay, of the rules I could follow that would be relevant to this case, which rules, if I followed them generally, and if other people followed them, would produce the better consequences? And the key difference here is that rule utilitarianism forces you to think about the consequences of an institutionalized practice rather than a possibly secret one-off event, like, say, taking Joe's organs. And this, if you think about this, and we can discuss this in class, it seems pretty clear that from a rule utilitarian standpoint, it would be a bad idea to harvest Joe's organs and, secretly euthanize Joe and take his organs, because you think, what if you turned that into a rule? What would happen? And we'll discuss this in class, but I think it's pretty easy to see why the consequences of making that action into a rule that you follow on a regular basis would obviously not be good. The quarantine example, that one might not be so clear, and we'll talk about that one in class as well. But again, the key idea between act and rule utilitarianism, are you asking what are the consequences of this particular action in this particular setting versus what if I made it a rule that I'm going to follow and do this on a regular basis and sort of institutionalize this in like the healthcare system and the public health system and so on? And that might be a different set of considerations. All right. Bye-bye, everybody.